Hi everyone, this is Dr. Heather Austin Robillard again, and this lecture is going to be the individual therapy lecture. This video lecture will move the course into more specific information about the treatment of substance use disorders. But before we start, I'd like you to kind of reflect on the following questions. What is the goal of therapy? I'm sure you all might think, well, to create some form of change. And I agree that this is a simplified and good answer. But then my next reflection question would be, what do you think change is? What specifically needs to change? And how do we as professionals and future professionals help someone to change? And of course, I'm sure there are plenty of very long answers to these questions, and hopefully over the next few module video lectures, we'll be able to learn the myriad of ways that we can answer the question of how do we produce change. So in this lecture, we will go over a few integral components of all the formats of therapy. The Therapeutic Alliance, and then we'll move into learning several popular methods of or approaches to therapy, specifically individual therapy like behavioral, cognitive, and interpersonal. So one of the most critical elements to therapy is actually the Therapeutic Alliance. This is defined as the relationship between the therapist and the client. In fact, the Therapeutic Alliance has actually been found to be the most important factor and element in creating change. Some even say that it doesn't matter the model of therapy used, as long as you're able to join successfully with the client, then you have the most impact for change. A therapeutic alliance is that trust that is developed between the therapist and client and allows you to work together effectively. Imagine that you're seeing a medical doctor who is forgetful, disorganized, and made recommendations for treatment that just didn't make sense to you. You probably wouldn't trust that person, and in return, you're most likely not willing to take the person's advice. The Therapeutic Alliance is supported by trust, support, encouragement, acceptance, and truth from the therapist to the client. It typically develops over a long period of time, but sometimes it could also happen in just a few sessions. The alliance allows the therapist to challenge the client and to grow in different ways. It keeps the relationship from being disrupted during difficult points of the treatment. So therapists can actually create a therapeutic alliance in many different ways, and for each therapist it just kind of depends on their style. But most often the way to create this is by reinforcing the client or providing some sort of validation. Yes, I can understand why you might feel that way in this situation. Something similar to that type of statement. Another way would be to provide empathy. That experience must be so painful for you. Another way is taking care of your own stuff. This point is connected to the issue of self of the therapist. Are we addressing our triggers in the room? Our own personal things that might prevent us from seeping into our professional work? Are we addressing our own triggers or our own stuff that might be seeping into our professional work? If not, you might find yourself oversharing or making the sessions about you instead of the client. Imagine seeing a therapist who always jumps in and says, I had the same thing happen to me. This is probably not going to create change, and many people won't pay to become the therapist themselves. Confrontation is another way to develop a therapeutic alliance. Now, this might seem like it would rupture a therapeutic relationship. However, clients come to therapy to create change, and they may need to be given that gentle push to work through their problems. It's all about how you actually handle that confrontation that develops that therapeutic alliance. In individual therapy, we focus on the client with little attention paid to the other individuals in the client's life. There are several well-known models of individual therapy based. Some include. On the right side of the screen, you will see a model that depicts the fundamentals of individual therapy. A person's thoughts create feelings. These feelings then create behaviors, and behaviors then reinforce the person's thoughts. What might be some real-life examples you can think of how this might play out with a client? Here's an example using addictive disorders. Let's say you have a client that says, lonely, I am so lonely. People just don't like to be around me. I must do something to push everyone away. This is a thought. This thought likely creates the feelings of hopelessness, sadness, and depression. The feelings then call for a behavioral response. If we think about the process model of addiction, and that this person feels pain and does not use a healthy coping mechanism, then the person will turn towards a compulsive behavior. For the sake of this example, we'll use alcohol as their behavioral response. The drinking or the behavior becomes problematic, and people start to slowly remove themselves from the person's life because of the consequences of their behavior. Then these behaviors end up reinforcing the original thought of being lonely and no one wanting to be near them. Pretty simple, right? So, behavioral therapies are well represented in the field of addiction and recovery, and they have research to support their effectiveness in treating addictive disorders. Informed by many of the basic principles of behavioral therapy, it focuses on the observable behaviors and thinking about the automatic responses, something like cravings. It aims to distinguish the undesirable behaviors by using aversive stimulus with the undesirable behavior. The behavioral models can be simplified into thinking the behaviorist wants to create change by having the client do something different. This form of treatment is based on the classic conditioning. Remember Pavlov's dogs and how they were conditioned to salivate when they heard a bell? And operant conditioning, looking at the cause of the behavior and its consequences. Think of B.F. Skinner and the mice who received reinforcers or punishers to increase or decrease the presence of a behavior. And the use of reinforcements or punishments. The change is then created in helping the client to recognize that changing their behavior can lead to changes in how they feel. To do this, we help the clients learn how to self-monitor. They log their activities that they engage in during the day and then examine those. Therapists help to create a client with new positive activities. They may use role plays, or most commonly used are behavior modifications, where the reward is given for positive behavior. Finally, the therapeutic process in behavioral therapy aims to help break the associations between the stimulus or the trigger or craving and the undesired response, the use of the addictive behavior. So cognitive therapy is different from behavioral therapy in that it focuses on changing how people think. The thought process is the focus of cognitive therapy. When we help clients change the way they think or view things, this is considered a second order change, or helping a client create a new way of thinking about change. This form of change requires new learning. This differs from behavioral therapy, which is a first order change, where change deals with the existing structure of doing more or less of something. It is the process of restoring balance but not changing the cognitive level. Cognitive therapy is helpful for addiction and recovery because we know that addiction distorts an individual's thought process and the need to use becomes automatic. Remember in the previous modules where we discussed the disease model of addiction and the neurobiology of addiction. When the go circuit takes over and stop circuits shut down, the need to use becomes automatic, and it makes it difficult for the individual to process with their prefrontal cortex what they should be doing, which is that rational part of their brain, which becomes underfunctioning in the disease of addiction. Cognitive therapy also focuses on an individual's defense mechanisms, or a specific way of thinking that allows the individual to protect themselves, protect their feelings, which is the process of distancing themselves from reality or avoiding unpleasant thoughts. There are some very common defense mechanisms that you likely already have heard of. Minimization is when someone tries to reduce the severity or the action of the situation. For example, the person who gets caught drinking and driving might say, "But I was driving and fully remember the drive home from the bar. I mean, people do a lot worse. I didn't get into an accident or kill anyone. I know when I'm too drunk to drive, and I wasn't too drunk." That's minimization of the situation. Rationalization is creating false excuses for one's unacceptable feelings, thoughts, or behaviors. An example of an individual addicted to alcohol saying, "Everyone goes out and drinks and drives. Why can't I?" Denial is the refusal to accept reality or fact and acting as though something does not exist. This is a common defense mechanism in addiction and recovery field. The person who is not ready to admit that they have a drinking problem and says that they don't have a problem are using the defense mechanism denial. Cognitive therapy will work with clients to challenge these defense mechanisms or adjust the lies that the individuals tell themselves to begin to open the client up to the need of change. Cognitive therapy helps to uncover and identify the inaccurate thoughts and feelings a person has. Therapists then work to help the client challenge their own automatic thoughts so that if the client thinks, "I'm too stressed, I need a drink," the therapist would help the client challenge the idea that drinking is what is needed to manage their stress. The therapist also works to uncover generalizations or blanket statements that the client makes or tells themselves. These are those always, never statements that make little room for exceptions. A client might say, "I can never do anything right." Then they will not be motivated to look at how they can change because they never do. Addressing those generalizations can help make room in the client's mind for thinking about and doing things differently. The final step is to solidify accurate thinking. The new thought needs to be made more permanent, and the therapist will help the client practice different techniques to solidify new thinking. Now, interpersonal therapy is about repairing relationships in an individual's life, helping them to improve communication, how they relate with others, and their ability to manage their emotions. The core belief on creating change here is that interpersonal therapists believe that there is a connection between one's emotion, how they interact with others, and their own mental health. This change is about helping to heal relationship with one's higher power, themselves, or others. In interpersonal therapy, therapists help the client learn to accurately identify the emotions they are feeling, where it is coming from, and how to properly express those emotions to others. And finally, dealing with the emotions that they've been ignoring in the past. Now, some important things to identify includes the difference between primary and secondary emotions. Primary emotions are the first emotions a person feels consequent to an event. These emotions oftentimes get masked by the secondary emotions and less often recognized by the client. Secondary emotions are those that are felt after the primary emotion. They tend to be easier to identify and oftentimes are more socially acceptable to express. A person who feels rejected by a loved one may quickly move into feelings of frustration, anger, or rage. It's often easier to be angry at one's partner rather than be vulnerable and share that they feel rejected. Helping clients identify their primary and secondary emotions would be one technique used in interpersonal therapy. So some of the specific intervention methods discussed in your reading that have been found to be beneficial for substance use disorders include motivational interviewing, EMDR, mindfulness, and also taking the harm reduction approach. Each of these interventions can be useful when doing individual therapy with clients. Motivational interview comes back to those stages of change, the Prochaska and DiClemente stages of change we learned earlier this semester. You identify which stage of change that your client is in and then work at helping them move up the continuum. These 4 processes include engaging the client to work with the therapist, focusing on the problem and identifying goals, evoking with highlighting reasons to change based on the client's own feelings, and move towards planning. Planning is when they are ready to make the change. In order to do these, the therapist brings elements into therapy like teaching acceptance, having compassion, and collaborating with the client. EMDR stands for eye movement desensitization and reprocessing therapy. This therapy has been found to be very effective with individuals struggling with trauma, which is common among substance use disorders. It focuses on removing the negative feelings from specific memories. using an eye movement desensitization method. Now, EMDR also uses mindfulness techniques, which are also helpful when working with substance use clients. Mindfulness is the practice of being aware and non judgmental of the present moment. Using this with individuals in recovery can be a coping skill that helps them deal with stress and negative emotions. Now, in previous classes, you've learned about the harm reduction approach. Abstinence, or the desire for abstinence, is just not a realistic expectation for some people. This is usually used as a last resort. And while individual therapy should never be conducted while the person is under the influence, they may not have the means or be willing to get treatment in order to become completely abstinent from their drug of choice. This is where the harm reduction approach can be used as a way to help reduce the harm of their use. These harm reduction methods can include controlled drinking, medical management like Suboxone, or other types of reducing the harm in their lives. So in this lecture video, we have moved into the treatment modalities focusing on the individual therapy modalities. You will learn more about the other types of therapy, including group and family therapy, in the next couple video lectures. Thank you.